lower risk of infection. So just sort of remember that they're just one of many layers of protection. So that's one thing. Secondly, they're sort of the cheapest, easiest ways to protect yourself. And the bottom line is that masking works, and is really easy. That's the thing. People always come to me and come to physicians in general and say, hey, what's the best way to prevent illness? I don't want to take a pill later. I don't want to take medication. How do I prevent this? Well, here you have a really easy way to prevent something. And we know that masks work to prevent illness.
Okay, so can you touch, because this is something that comes up a lot in conversations that I have with people, but with masks, is it true that they're only effective if you wear them the right way? So like, for example, if you sneeze into your mask, or you know what I mean, or then you put your mask on and you touch your face, and you touch your, you go to the store, you wear your mask, but you take your mask off when you get to the car, you're touching your face, you're touching your car, so do you mean they're effective no matter how you're wearing them, or are they only effective if you're wearing it correctly? Because I can tell you, like with my kids, they're not wearing them correctly.
Right. The biggest issue is that, so what does a mask do? What does a mask do? Right. So what a mask does is it prevents your spit, because that's where the virus lives, from getting on other people, and it prevents other people's spit from getting on you. That's the bottom line. And if it does that, then it's working. That's the bottom line. Okay, that's it. So if kids can do two things, if they can sneeze and cough and laugh and scream into the mask instead of out, and then if they can wash their hands, if they can do those two things, they've probably prevented a whole large, big percentage of illness that I can't put a number on.
Right. Even more than COVID, like illness period.
Exactly. Illness period. Illness period.
So what I'm hearing you say is it's not a perfect, it's not a perfect solution, but it's better than nothing, right? Which is
it is elegant, it is easy, it is cheap, and it is real good for people who you don't have to be a genius to do it, I guess is what I'm saying.
Exactly. If you're like me and you have too much to do already, a mask is the easy. Just put on the mask. I can't go into zinc and immune and vitamin C and 2 doses. I'm gonna put on a mask because that's all I can handle.
Put on a mask.
Now this might be jumping ahead a little bit, but if you're vaccinated and you're not, you choose not to wear a mask, how do you feel? Like, what's the stance on that?
So and the CDC is probably going to change their recommendations. It's supposed to come any day now, potentially today actually, to say that if you're vaccinated, you no longer need to wear a mask. And I will say that a lot of healthcare workers are going to push back on that, myself included. And there are lots of people on both sides of that argument. And I will say that the pushback against that is that obviously we know you can still transmit disease even if you're vaccinated, although the likelihood is much less, right? Much, much, much less. Most of us in healthcare and public health feel like, why wouldn't you do the easiest thing that you can do to prevent illness? Especially in large groups, especially no one's asking you to wear a mask at home in your house. No one's asking you to do it in your cubicle at work. No one's asking you to do it in your car. The only places where healthcare workers would recommend that you wear a mask is in mixed groups where you don't know if everyone's vaccinated or not, because those are the highest risk pools. So we're probably going to push back and say, fine, if you know all 10 people that you're with are all vaccinated, fine, you don't all need to wear a mask. But if you don't know everyone's status with the group you're in, it's probably still safer for everyone to throw a mask on.
Yeah, thank you. Has there been any research that has shown that there is a segment of the population that should not mask because it can be harmful? You know, people with pre-existing conditions,
Sure.
People who are asthmatic, have breathing issues,
Sure.
Anything like that.
Sure. So medically, so there's two sort of groups that masks can be difficult for. And I won't say that it's completely contraindicated, because masks aren't actually contraindicated for almost anyone.
Anybody. Okay.
But there's two groups that they can be difficult for. One is what you mentioned, which is underlying lung disease. And I won't say that they shouldn't wear them at all. They should actually go to their doctor and talk about it, because sometimes it's a matter of changing the type of mask that you're wearing. For example, certain masks lead to higher humidity of the air that they're breathing. And humidity is actually what leads to more reactive airways, more wheezing and things like that. So it's not actually that they're having a CO2 problem or a low oxygen problem, because masks don't actually cause low oxygen or high CO2, but they do make it hotter around your face. They do actually cause, on scoring scales, the perception that you're breathing harder, things like that. So they do lead to discomfort. So people with underlying lung disease should talk to their doctors about the kind of mask to wear. So that's sort of one group of people. The other group of people have either developmental delays or severe mental illness. People with severe panic disorder, severe claustrophobia, severe anxiety, or, for example, young children with developmental delays who just can't keep the mask on. Even for people like that, they're like, for example, the psychiatric associations, they've actually come up with protocols for how to desensitize people to wearing masks, because it is still safer, because those people are still at very high risk for getting COVID and getting severe COVID. So there are actually desensitization protocols, like wear it around your house for 5 minutes a day for a week, then wear it for 10 minutes a day for a week, wear it in your car, for 20 minutes to sort of desensitize and learn how to wear it well.
There is something to that, though, because I will say, I had to fly recently and wore a mask for, it was a 4-hour flight, and there's something to that where I'm not claustrophobic. I don't really have any underlying issues or conditions that I struggle with. But by the end of that 4 hours, I mean, I think mentally, you just having something covering your mouth,
face,
it's stressful.
Hot,
and I wanted to just like rip it off.
You want to take it off?
Done.
Yes,
like
absolutely.
It just felt like I was so confined, and it was just, I did not like it at all. But
yes,
I mean,
it's true.
At the same point, you got to do it. So
right.
Well, and that's something that we can talk about later. I talk about specifically for exercise. Some of the best masks for exercise specifically are the ones that are very structured, that hold the mask away from your face. So if they can hold them further away from your face, it gives you a little more space. When you see people wearing masks that are so tight to their face that every time they breathe in, you see it sucking against their face, they're going to sweat against it. They're going to make it very hot against their face. They're not going to feel comfortable. They're not going to like it. And ultimately, and this is something you've probably heard over and over again, the best mask is the one that you will wear. The one that you will wear. The mask, the best mask is something that you can reliably wear and that fits well. So if it's going to make you uncomfortable, that's not the best mask for you.
Yeah.
Wow. That's great. That's great advice. The one that you will wear, not the most fashionable one, not the one that everybody says you should wear, but the one that you will wear, because it does you no good if you throw it off and never wear it.
Exactly. And whether it's a KN95 or an N95, if you'll wear it and it covers your droplets, that's the one. That's the one you want. So there's been a lot of controversy, Sonia, about whether it is safe or not to wear a mask, especially during physical activity. You kind of alluded to that a little bit about, is it a CO2 problem? Is it a lack of oxygen flow? You kind of said it's more humidity. It's more the perception of not being able to breathe. So is there actually any scientific evidence that says masks put people at risk when they are performing physical activity? So there's not. So there were two very small studies done at the very beginning of COVID that suggested that people may fatigue sooner if they wore masks. Okay. But they were very small and they weren't necessarily, they were kind of thrown together quickly at the beginning of COVID. So they weren't very well done studies. Since then, there have been about 10 to 15 more studies that show that that's not really true. That oxygen levels are the same. Nothing changes in carbon dioxide level. Nothing actually changes in lactate level. So nothing actually changes in how much you exert. But what does change are these perception scores. So people feel more short of breath, like you just mentioned. Bree.
Yes.
People feel more short of breath.
I get that.
At less intensity. And so it's really more about just having something covering your face.
Okay.
I will criticize these studies though. You know, being very pro mask, I have to be honest though, I will criticize these studies. They've only really studied very healthy people who already exercise a lot. Okay. So we're talking about people who already dance and are dancers, and all these studies are in very physically fit athletic people. I don't suggest that someone who's never exercised before all of a sudden pick up and run 5 miles with a tight mask on.
Right.
So just the way you should, you know, ease into exercise, you should ease into exercise with a mask on too.
Right.
But what about children? Because some people specifically have a problem with the idea of children wearing masks during physical activity because for whatever reason their lungs aren't developed yet, or they're not used to that kind of strenuous restriction. There's a million reasons, right? And valid. It's valid. As a parent, you're concerned about your kid. You want to make sure you're protecting them, that you're protecting them from COVID, but also protecting them from not being able to breathe
damage, right?
Properly breathe. So is there something
physiologically? So physiologically, no, kids are not restricted in any way. So your actual breathing function is not restricted by a mask in any way. Now, will they have that same perception of maybe fatigue sooner? Yeah, potentially. But are they actually restricted physiologically? No.
Okay.
Okay. Got it. And that mental, it's like I said though, that mental thing of like,
I feel it.
That's real. Feel it.
That makes you feel a certain way. And so it's really important, I think, to distinguish between what's actually happening in your body versus mentally what's happening. And I'm not saying it's not a problem. I'm just saying they're two very different things, right?
They are. And sometimes it's, I introduce myself in the hospital often as a lung doctor, right? I say, I'm the lung doctor. And so let's talk about your lungs. And, this person will tell me they're very short of breath and it'll be from, for example, their heart disease. And I'll have to explain that not all shortness of breath is just a problem in the lungs. Some shortness of breath can be from your head. Some shortness of breath can be from your heart. Some can be mechanical because something in your belly is pushing up on your lungs. So it's like an anatomic problem. So the feeling of shortness of breath can come from a lot of places. And so I've spent a lot of COVID explaining that to people. Feeling of shortness, just something going in your and so some of it is just a retraining how to do these things with a mask on. And that's tough to do, but it's also important if you want to sort of protect yourself, because one thing we don't talk about a lot when people ask me about masks is, and I say it a lot in vaccines. So for example, when I say, you should get a vaccine, don't compare a vaccine to nothing, compare a vaccine to COVID. And so I'll explain it here too. Don't compare a mask to no mask, you compare a mask to having COVID. So you're comparing wearing a mask to what if you get long COVID and you're short of breath forever?
Right. So you're on a ventilator versus a mask. I would choose the mask.
So that it's kind of risk and benefit in those terms.
Yeah, absolutely.
Yeah, thank you.
Yes. For those of you who are just joining us, we are talking to Dr. Sonia Compton about whether it is safe and effective to wear masks during physical activity. As we mentioned before, this is a lively conversation that, lively, that's a good word, a lively conversation that is happening all over the country in dance studios and conventions and competitions all over the place. So we want to hear your questions. We want to hear your comments. We want to keep it respectful. So please pop those in the chat whenever you get a chance. So I have a question specific to dance. So as dancers, lifts, partner work, close formations, touching each other, being less than 6 feet away, less than the social distancing space is part of the nature of the art form. So I know that there was this big, it's not enough to wear a mask. You also have to social distance and wear a mask. And I know with your explanation with the droplets, you're keeping the droplets in the mask. But is that true? Are masks really still effective when we're actually breathing on each other, touching each other, being so close in proximity? You know, is it kind of like, well, what's the point of wearing a mask where it's not going to be effective anyway?
Yeah, that's a great question. That's a really good question. And so from a medical perspective, the answer is yes, the mask is still helpful because everything you do in COVID is about decreasing your risk some amount, right? So none of the things are perfect. I think Bree said that earlier, right? So none of the methods is perfect, right? So vaccination drops your risk this much, masking drops it this much, social distancing this much. Each thing you do drops your risk a certain amount.
Right.
So the idea is to do any little bit you can. And honestly, if you can't do the social distancing, which, I mean, you're dancing, you shouldn't, right? Like, I mean, you should during your practice, but maybe not during the performance, right? Then the masking is your go-to. In fact, you should wear a better mask, right? At that moment, you should wear a better mask to prevent all respiratory spread.
So that's a great segue. Yeah, that's a great segue into the next question because we've heard about K95s and how K95s and KN95s and that those are the best masks to use, but you also see people wearing surgical masks, cloth masks. There's all different, there's some
plastic visors.
Yeah, the filter, there's so many things that people are doing. And I heard you earlier say, the best mask is the one that you will wear and that's reliably and fits well. And I hear you saying that, but is there one that is more appropriate for kids under 12 versus over 12 and adults? One that you would recommend for physical activity that people should look at? I mean, I know this a sponsorship or anything like that, but I'm just curious if you have ones that your go-to recommendations for people.
So I'll tell you that for exercise and activity, you want a certain kind of mask as opposed to walking around, shopping and being at school or at work. So for exercise and activity, you want specific things in a mask. One, you don't want to sweat in a mask. Okay. When you sweat in a mask, if it gets wet all the way through, you've defeated the purpose, right? Because then you have droplets on both sides. You have potentially droplets getting on both sides. So you don't want a mask to get wet. Okay, so that's one thing. So surgical masks during activity are really not ideal because they're made of 3 layers of paper. Okay. So those are not really ideal. What you want during exercise is really more than likely is a dry wicking type of material. In general, for COVID, you want at least 3 layers of material. That's sort of the minimal amount of barrier material that's helpful. So dry wicking, nothing that gets too wet. And then the structure that I spoke about earlier, and even though they don't look that great, what you want is something that sits off of the face a little bit, so that you don't feel that that tightness on your face that makes it feel so hot and so tight. So I mean, I do have some brands that I like if, for exercise. I think Under Armour makes a nice one that's kind of big. Adidas makes a nice one that's a little bit big, but it's a lot better. And then Janu makes a really nice one as well.
What is it? What's the last one?
JAANU.
And do they make youth masks? Or because here's the problem with the kids ones is that you you have to find them small enough that
Yes.
they fit the kids, or else it's ineffective
Yes.
because they're just falling off.
Right.
And
Janu makes a kid's mask. They do. It's actually, that company is actually she's actually a former physician who started a company that makes scrubs and stuff, and then she started making masks as well. So they're moisture wicking, they are washable. The other thing for exercise is always have a backup mask. Always, in case it gets sweaty and too wet that you can't dry it out, because once it's wet, that's it. It's not helpful to you.
It's not helpful anymore. Wow.
It's
I have a question about sports masks, because I know at the very beginning of the pandemic, everybody was wearing those ones that look like they had gills in them, that have like the little, it's almost like air holes or air pockets. And then it was like, those do absolutely nothing because they actually let.
Yeah. So you froze up for a second.
Is that true?
Yeah. So I think the Adidas one has the big things, but what you don't want is, you don't want the ones that have a circle that has a big valve. That you don't want.
Oh, okay.
That is a one-way valve, actually. So basically, you can breathe in fine. It lets all of your air out, though. So it kind of defeats the whole purpose. So no valves. In fact, most places that are strict about COVID won't allow you to wear a mask with a one-way valve, a one-way filter. So you don't want that ever, anywhere. You don't want it near you in your studio. You don't want it anywhere, because the person's just blowing all their air out. So you don't want that.
That's good to know.
Right.
Because you see people with those masks and you just assume, you're like, oh, they have a really legit mask.
Yeah. No. It's super legit.
I'm going to take my paper mask and go now. Yeah.
No. Oh, and let me mention the others. So N95s and all those. Did you want me to mention those?
Yes.
So N95s, I actually busted out. I have them all here if you want me to sort of.
I mean, it's good for people to know, I think, right?
Yeah. Okay, so N95s are, you have to be fit tested for an N95, first of all, for it to actually block 95% of all particles, okay? So you can buy them online. They're NIOSH certified. They only go behind the head. You'll never find an N95 that goes over the ears.
It goes on the ears.
It goes over the head like this, okay? And they come in green and different colors, but this is the one that I've been fit tested for through my hospital, okay? That means that when I'm actually fitted for it, 95% of all particles are blocked completely, okay? So this is like a hospital grade N95 mask, blocks 95% of everything. Nobody actually needs to have this in practice for COVID right now, because if you're not fit tested for it, you're not getting 95% blockage anyway, okay? The next best thing in order of blockage is the KN95, which you've probably seen.
Yes, that's my go-to. And you have a pink one. Is that pink? Oh my gosh!
I'll give you the. I got pink and purple and all the colors. Okay, so this.
He's in the cool kids club.
Yeah.
Right.
So these are not registered by the FDA or NIOSH or anything. This is by a comparable, I want to say either South Korean or Chinese body, but that's where the KN95 comes from. And they report almost 95% blockage, but you can never fit test for it. Anything that goes over the ears cannot be fit tested. But this is this is as close as you can get. So this is, for example, what I would recommend for somebody, not necessarily just walking around all the time, but like travel on an airplane, something like that. The good thing about this, though, also is that it stays off of your face quite a bit. So it stays pretty far off of your face. So it's also not, causing too much, it's not hurting your face too much. Just remember, for all masks, to pitch it down on your nose really well, because what you want is, you don't want a whole lot of gaps all around here. Okay. So KN95.
Quick question, Sonia, about KN95s. Are they reusable or are they one time?
So good question. So technically they are made to be disposable. Okay, they're made to be disposable. However, when you use them one time, like, so for an example, a one-time use of an N95 is like a full day, is like a full like 8 to 12 hour day. So like I wear one in the hospital all day long for 12 hours before I toss it. So if I wear this out to dinner, I'm going to keep it because I've only used it for like 2 hours.
Got it.
Does that make sense? Like if I wear it to the mall, I'm going to save it because it's expensive.
Yeah.
Right.
And
Exactly.
the way you preserve an expensive mask like this is you either wear a cloth mask or you wear something else over it. And then you put it away nicely into a plastic bag quickly. You take it off from the ear loops always. You try not to touch it much and you put it into a bag quickly.
I was going to ask that.
But once you get to about 8 or 12 hours of use, it's done. It's done.
That's good information.
Yeah.
What's that one, Sonia?
This is a KF94.
Ooh, I've never heard of that.
Like this. So this is the next step down.
Oh.
Much more comfortable than the other masks.
Oh wow. KF94. Is that what you said?
KF94. Also by either one of the Chinese governing bodies or Korean governing bodies. Much more fitted here. So again, if it's nicely fitted to you, supposed to block about 94% of particles, but probably doesn't get that much because it can't fit every face properly, but is a little off the face here. So much more comfortable. You can wear it a lot better.
Is this a good one for physical activity or more just everyday wear?
This is a paper mask again. So everyday wear. All these are paper masks. So none of these are necessary for that. Yep. And then this is just your regular surgical mask. So this is sort of the order of, N95s, your sort of ultimate for blockage, then KN95, then KF94, then surgical, and then cloth. But for physical activity, I recommend the dry moisture, dry wicking, off the face, reusable for those.
Yeah, thank you.
I don't have any of those.
It's so helpful.
Activity.
Yeah, no, that's so helpful. For those of you popping on and off on Instagram.
That is so helpful.
I am Bree with Paula. This is Melissa McDaniel. This is Beyond the Steps. We do this every Friday. We're here talking with Dr. Compton today about is it safe and effective to wear a mask during physical activity? This is a hot button issue, especially in the dance world. COVID is still very much a part of our day-to-day lives, and it's affecting, pretty much everything in the world at this point. So, we're asking all the tough questions, and there's a lot of things floating around out there, some misinformation, and it's hard to know what to believe. So we're getting another perspective from Dr. Compton today, an evidence-based perspective, a research-based perspective. So we hope you'll ask questions. Please pop those in the chat box on either platform, and we'll make sure to get those answered for you. Dr. Compton, I wanted to clear this up for a while. Does being outside in a bigger space really make it safer to go without a mask? Because, and I do this, I have done this with my kids. I will say I'm being honest. Kids and parents, when they're in, outdoor spaces and you're not in close proximity to very many people, because it's a big space, because it's outdoors, maybe teachers take their kids outside to dance outdoors. The masks come off, right? So we're giving everybody a break. Is it safe to dance without masks in that capacity, in that environment? Is that myth, or is that there's some truth to that?
Yeah, so there actually is some truth to that. Ventilation is probably one of the, when I said, we talk about all the layers, and we've talked about that. That's actually called the Swiss cheese model, all the different layers of protection for COVID. And that's one of the major layers is ventilation, actually. And so just opening windows, having fans going, having a HEPA filter running, that actually reduces risk greatly by a very large percentage. And the way it does that is it just simply dilutes the number of particles in any given cubic foot of air. And by doing that, you decrease your risk greatly. So yeah, ventilation, I mean, if some of these, and not just schools, I'm sure all gyms, studios, if they had better ventilation systems, there would probably be less infections associated.
Thank you. That's
yes, that is very true. The more you can do outside, windows open, fans on. In fact, just simply putting a fan in the window to pull air would probably decrease risk significantly.
Okay, there you have it from Dr.
I just knew you were gonna be like, no, that is not true. That is a myth.
I know you know so much. We get our hands slapped on the show so much for like the personal choices we make, and we're like, we're guilty, but this time we're not. That's good. That's good news. I can tell my kids
CDC page on ventilation and fans, and I'll link it. I'll send it to you guys. There's a whole CDC page on what kind of fans to use and what kinds of HEPA filtration units to use, and I recommended it a lot over the past 2 years. Yeah.
Get outside. There you go. Get outside.
Yeah. Get outside.
Now you're in Michigan, so you never get to get outside. Down here in North Carolina, we actually get outside.
So it was let me tell you this short story. So it was a beautiful day yesterday. I looked outside, the sun was shining. There was like all the snow had melted. And I was like, oh my gosh, like we're going outside. Hadn't been outside yet. Didn't look at the weather. Went outside, froze my face off. It was like 21 degrees.
Where are you in Michigan?
I'm in Michigan. My kids were like, can we
Where are you? Where in
I'm
Michigan?
like, no, we're burning energy. Let's stay outside. But I was freezing. And it snowed today. So we're not outside yet.
Wait, tell me again, where in Michigan?
Half hour outside Detroit in Clinton Township.
Okay. I went to med school in Detroit.
Oh my gosh. Yeah.
I went to Wayne State.
Yes, absolutely. I graduated from Oakland. Yes.
Okay.
So I love that. But yeah, so no, we're definitely not outdoors yet as much as we want to be. Melissa, why don't you go to the last question, and then I know we have a lot of homework and links we want to get to people.
So Sonia, in this world, our studio owners, our competition directors, our convention owners are making decisions right now about whether to require masks or not, because the competition season is in full swing now. And I'm more than sure that they are facing pushback from parents and kids, because I have been facing pushback from parents and kids about masking. So what professional advice? They are in a conversation right now with someone who is like, no, not doing it. It's not happening. What professional advice would you give them to have this conversation?
Well, so a couple things. I think that one is, I think that your local case numbers are probably the most important thing to use to make decisions. And I think that your local vaccination rates are probably the most important thing to use to make decisions. I think the more people that you have vaccinated and the lower case rates that you have around, the more comfortable you can be getting rid of masking if you're getting a lot of pushback. If not, then obviously everything that you can do to mitigate risk is the best thing. And the last thing that I would just say is keep everyone flexible. So if there's really that much pushback, it's fine to get rid of masks now, with the option always that if case numbers go up, hey, we might have to bring this back. So I think as long as that's something that we've been missing, is that there are no hard stops here.
Okay.
There's going to be another variant. There's going to be another surge. It's not gone, and it's not going to be gone for a long time. So everyone needs to stay flexible with this. The next time it comes back up, everyone just has to be open to getting it under control again and doing it before it gets bad. So someone has to just kind of always be looking at your local numbers and your local rates to say, hey, the next couple of weeks are going to be bad. Let's start getting it under control again.
Right.
It's fine. It's on the downswing right now, and that's great. So fine, we can ease up right now, but before it gets bad again, let's keep the option to opt back into all these things. I think that's the best way to approach.
Yeah, thank you for that. Flexed Feet 78 on Instagram says, thank you. This is such excellent information. It absolutely is. I've learned we should have done this like back in the beginning of the pandemic, because I swear like this is better than the CDC.
Right. It is. It is.
So yeah, so glad we did this today. And for those of you that are just popping on, we're talking with Dr. Sonia Compton today about, is masking safe and effective for physical activity, specifically dance related activity? We have had a great conversation today, and I encourage you, if you're just catching the end of this, to go back and watch the entire thing on our Facebook page, where we have a YouTube page that we can direct you to watch the full playback. But please do it and share it, because this is great information, especially as, you know, different variants are introduced into the mix. And, you know, COVID, like Dr. Compton said, it's not this, there's no hard stop. It's going to be part of our lives for a while. We're going to have to figure out how to deal with it. It is our new normal. So that being said, Dr. Compton, we like to give homework to our listeners, watchers, whatever you want to call it. You know, one step they can take between now and next week to see some sort of improvement, or take a step of improvement in the area we're speaking of. So when it comes to masking, what is one piece of homework you want to give people this week? It's something they can do in the next 7 days.
Specifically about masking or COVID in
general, or just like what on creating their policy? Like, what is something that you urge them to look into, research, you know, anything?
Sure. Well, I think my recommendation would be to think about this as a community issue and not an individual issue. So step back for a little bit and don't think of masks as personal discomfort, and think of it as, what do masks do for the community? So look at your community rates, look at your community hospitalization rates, and think about what effect one small thing can do for everybody around.
Yeah, thank you for that. And we're going to get, Dr. Compton has generously provided so many links for you today. We're going to copy them all into the chat in a second. We also encourage you to take the Steps Initiative course on our website. You can find that on paulaperformance.com. Melissa is going to link that in all of our platforms. This is a 5-part course series. It's all online. You can take it at your own pace, but it's a digital course series. It's going to tackle topics like racism, gender and equity, sex abuse and prevention, psychology, nutrition, dance medicine, and science. And each module was curated by an expert in their field. And again, you can take that at your own pace. It's evidence-based research and resources for you to kind of dig deeper on your own. But ultimately, we are trying to make sure we're creating happy, healthy dance for all, and knowledge is power. The way you do that is by doing your research and making sure that you understand the topics at hand that are impacting the dance community, and that your studio is set up to be a safe space and a safe culture for our students, so that we can make a happier, healthier dance world. That's what we're all trying to do. We also want to encourage you during this time to make sure to check out our friends at YPAD, that's Youth Protection Advocates in Dance, and get YPAD certified this year. There is nothing more important you can do for children, especially with all of the issues that are plaguing the dance community around sex abuse, abuse in general, and how we can prevent those things from happening. When you know better, you do better, and our friends at YPAD do a great job at education. We're giving you 25% off with a code. Melissa's going to put that in the chats, and the link on how to register. And when you enter the code APOLLA, APOLLA, all caps 25 at checkout, you'll get 25% off. Dr. Compton, you provided some data and some links for us. Can you tell us a little bit about all these links that you sent, and just what people are going to learn when they click?
Let me see which ones I gave.
The one was Washington EDU, masking up while working out. There's that.
Oh,
one. Yeah. And then the Mayo Clinic.
Yes, I think several of them were specific studies. Oh yeah, so the washington.edu link is a specific study that they did on young healthy participants in working out in masks. The Mayo Clinic link is a general guidelines on working out with a mask on. The PubMed article is also a link to a study on working out with a mask on. The next are the Dance USA guidelines for COVID. So there's just some very specific things that I guess one of the organizations for dance talks about what their recommendations are. So I thought it would be good to sort of provide that, what other dance groups are doing. And the last was also the Alvin Ailey organization, what their COVID-19 response has been specifically for their youth programs, since we did talk a lot about kids and this is about teaching kids, and so what they're requiring and what their data was for doing that, because I thought that was kind of important. And so just to kind of see what people around the country and what everyone's doing and what that data is based on.
Yeah, thank you. And again, it's so helpful to see the research and see and read the actual studies that were done. And thank you for providing that, because there is so much information floating around. Everyone's a doctor now. Yep. Everyone knows everything. And everyone. The sources are less than credible most times. Well, right. And I mean, who knew everybody could be a doctor? You went to school all those years, but now you can just get your degree on Facebook and everything's good.
On YouTube. Get it from YouTube. TikTok.
Yeah, we know. I know so many people that are now doctors. Who knew? But no, thank you for providing the links, because it is helpful to see that research black and white. And then for people out there that may have questions, want to reach out to you directly, how can people follow you? How can people find you? Please share all your info.
Yeah, sure. On Twitter, I'm Sonia VC MD. And on Instagram, I think I'm Sonia V Compton on Instagram, and both of those would be great. I'm still pretty private on Facebook, but other than that, Instagram and Twitter, I'd love for people to reach out to me on both.
Thank you so much. Thank you for all of this.
So much. This has been an amazing conversation. I'm hoping that
you guys.
Yes, I'm hoping that everybody who watched was able to take something away, whether you agree or not. I hope that you have a nugget of fact and truth that you can chew on and think about. Of course, you have your own free will. You can think what you want, but what we have provided to you today are facts from a professional. So take it as you want. Take it back to your medical circles of YouTube and talk about it. Let's talk about it.
Yes.
As always, thank you, Dr. Compton. Thank you, Bree. Thank you, viewers. Thank you, everybody who makes Beyond the Steps possible. We love doing this. We love doing it every single Friday, and we hope to keep doing it for a very long time. Please share with your friends, share with your family, share with your Facebook groups, share with everybody. This episode is available at Apollo Performance on Facebook anytime unlimited viewing. It's also available at TPDC_on_IG. If you go in the bio, you can link to my YouTube page where all of the episodes are there. Next Friday, we are going to, that's the 4th, next Friday, we're going to be talking about how does your mindset change as you transition from professional dancer to dance educator. We're going to be talking to Candace Hauser, a professional ballerina turned dance educator, about how that shift has to happen psychologically in order for you to be an effective dance educator. So please join us for that, 2 p.m. Eastern time. Until then, we hope you do your homework and continue your journey beyond the steps. See you guys next week.
Bye. Have a good weekend.
Thank you guys.
Thank you so much.
Thank you.